So welcome back to our YouTube channel. So today we are going to discuss about why AI hesitancy holding pharmacists back from fear to fear framework. So today I have again invited Dr. Pradyuman Rajput on our YouTube channel. So we will be definitely going to discuss a lot of information on this particular topic. So I really welcome you, Dr. Pradyuman Rajput, on my YouTube channel.
Thank you, Adnan, for having me. So I was finding this topic. It's quite people are quite hesitant on using AI in nowadays, and especially pharmacists. While it can improve a lot to them, but they should need to focus on why they are not taking part in that AI revolution and why they are getting away from it. So in this video, we will be debunking all these things, why they are hesitant and what they could provide to their individual level, even to the organizational level, and even to the national efforts in terms of healthcare.
Okay, so you can share your screen. Yeah, we can start.
Yeah. So the topic for today's discussion is why AI hesitancy is holding back pharmacists and how we can convert that fear into framework. So I'm Dr. Pradyuman Rajput. I'm a PharmD graduate and I have been a clinical pharmacist, and even I'm practicing clinical pharmacy in the community. And this thing I'm observing in the community as well as the professionals who are working in the hospital, that they are quite hesitant towards using AI. So pharmacy is changing. Are we? Just to give you an idea, we were the earlier adopters of AI in terms of technology, since drug designing, the drug discovery part, incorporated AI in the early 1990s. So that's how our field has been accepting the AI as the earlier adopters. But we are becoming late implementers because on the ground levels, on the root levels, it's been observed that pharmacists are quite not into AI. They're hesitant towards it. So what we are expecting? So patient is expecting faster answers because they have a lot of doubts and they have a lot of queries, they have a lot of myths that they need to work on. So in that case, we need to provide a better and a communicable answer. Then information overload. Every patient is being bombarded with a lot of content around their disease, around their medicines. So they need to also know which of the information is true. Then in terms of workload, every pharmacist is now observing increased workload in terms of patient, in terms of medicines. So that all is changing, and in that all cases, method remains unchanged. So what is AI hesitancy? So it's not a technical thing; it's a human thing. So what's the human thing here? The pharmacists are fearing of replacement. They fear of mistakes through AI, and they are in comfort with their old systems. And that all is complemented by their cultural conditioning. Just to give you an idea, for example, in an organization where new people are there, and in some some experienced 10-year-old staff may be there, and they might not be conditioned with the AI part because so in terms of cultural conditioning, there is a certain a work culture, and that does not promotes AI in their daily use because they think AI is just a new technology and it's making the pharmacist work more easier, and they don't want the things to be easier. So these type of conditioning are creating an AI hesitancy in the new people. So what are some mental barriers around it? So generally observed common thought patterns are like, my seniors never used this because at that time there was no AI even, but they are getting attached to it. And then some are like, I'm not technical, I don't know how to use AI, or they think it's like something coding because they never used it. And some people think, when will I learn this? They want to, explore courses or, identify more videos around it so that they think they would be learning AI more easily. And some people have this thought pattern that AI will replace me. So these are all barriers that are, avoiding the growth that can happen in terms of the pharmacist at the individual level as well as the organizational level. So there are silent users. This is the hidden reality. Many already use AI, but they use it privately. They don't want to speak about it openly. They fear they fear the judgment of the peers, and there is no structured guidance because even not the seniors are promoting AI in their daily use. But the thing is, AI won't replace pharmacists. Pharmacists using AI will definitely replace the pharmacists who don't use AI. So, what's the cost of hesitancy? So, what we are losing in the AI hesitancy part, we are losing time. We are spending more time identifying data, identifying guidelines. We are investing more energy on it, and we are also losing our clinical focus. Since we are most of the time into we are data sets or we are into guidelines, we get less time with our patients who deserve the most of the time. Then even we are lacking on the patient connection part. Since we are not, streamlining things, there is a certain thing that we are not able to give your patient a lot of a good time, a good communication which he can have. And even in terms of professional growth, you're lacking behind because you don't have time to learn new things. You are already into your daily work and you are not getting time out of it. So why pharmacists should use AI? So this is the real benefits, and obviously one using it will realize it, and one who has not realized it should focus on these benefits. That they will get a professional leverage. They will get more time with the patient. They will get more time with the providers. They will get a faster clinical preparation in terms of case studies. They would be able to identify the core things that they might be missing on their case studies. Then they would be able to better communicate their counseling points to the patients because AI streamlines everything. It streamlines the important data that needs to be the important information that needs to be communicated to the patient, and that will improve the patient understanding. And in the long term, that will also improve the patient related outcomes in terms of disease, in terms of morbidity. And and collaborative effort of such pharmacists working in our organization will improve the organizational efficiency. They would be able to cater more patients. They will be able to provide a better understanding to more patients on an average daily, and that will lead to a patient trust on the pharmacist as well and on the organization as well. So that's how pharmacists would benefit from the AI. So just to clear this thing, AI is not a clinician. It does not diagnosis. It does not gives you the exact medicine what you need to give. But what it does, it drafts you summaries. It summarizes you. It organizes things so that you get a better clear picture of the patient condition, the patient's medicine, and the information on which you are need to counsel. So the pharmacist, on the basis of the AI, would decide, contextualize, and give a better care to the patient. So, how can we adopt this thing into our practice? So, you need to start small. If you have not, if you haven't started yet, so you need to start small and grow smart. So, how you would be doing things is like on the initial level, you can use it for your convenience, for making posters for patient, like in a patient having specific disease condition, you can build some posters, some retention materials, some learning materials, some awareness materials. Or if a patient is in communication with you using some social media channels such as WhatsApp, you can frame a better reply that is more comprehensive and comprehensive to the patient. Patient understands well because we as a medical professionals we use a quite of medical jargons in our communication, and that might not be well understood with the patient. So what we can do is we can produce a layman sort of counseling to the patient, and that we can send it to the patient. And obviously, we are always in the loop. AI does it everything on its own. You as a pharmacist are there in between, and you use and leverage the tools provided by the AI to improve your improve your care in the community, in the hospitals. Then you can move towards support in terms of counseling drafts. In certain condition where patient is on multiple medications, you need to counsel, on each medicines, and that can be well summarized and streamlined by AI. And they can help you produce some counseling drafts, and that you can improve obviously based on your own knowledge and own experience. And then you can, make SOPs around it in the organization. And then tertiarily, we can use it as a clinical thinking aid. Sometimes there are chances of misdiagnosis or misinterpretation in the medicine part or the disease part. That's where we can use AI for case structuring, for getting a better, clear picture of the case of the patient you are handling. And that also improves your awareness, and also it lets you identify the possible interactions that might be happening in the case. Okay. So this is what a safe use framework look like. So what is a safe use framework? Primarily, it's based on the ethical considerations. We are not using anything unethically. We are not using any generated data as a evidence. We are using it safely. How? So first of all, when we query the AI, it will produce an output in terms of the answer we require. And what we as a pharmacist will do with our own conscience, our knowledge and experience, we will review that output, whether if it's right or not, and then we will clinically interpret it. And then if we find it okay, we will also find some proof on the internet, obviously on the research websites, where you can, on the PubMed, you can cross check the following output that it's true or not. So that's how you save time in all these things. And this all will be nothing automatic. You need to, it's a tool that you will be using in your daily practice. Okay. So, so what we need to build is an SOP-based AI workflows. So how that would be done? So, we are not randomly using AI. We need to build systems around it. So what's the system? It's a system is a definite set of instructions that we need to follow to get a desired output. And for this, we need to, test different prompts, test outcomes, or define the outcomes. And when we have a clear picture of it, we can, formalize a proper, patient education SOP or counseling SOP or an inventory SOP, and using certain prompts. See, it's all about prompts. AI is a tool, and it's purely dependent on the prompt you enter to it. So once you have mastered the prompt part, so that's how you can, create workflows around it. For example, you can create a prompt like case A, age, gender, the number of medicines, the comorbidities, the conditions, and that's how you can streamline a same pattern again and again to get a same outcome that is curated by all the professionals of the organizations you are working in, so that you don't get any other extra information or an unwanted information that is not valid. And that's how you can create an SOP based AI workflows. So this is the current problem we are into it. Most of the pharmacists, they are spending 80% of their time in the data part and the routine part, and only 20% time with the patients and the critical thinking part. And AI flips this. AI gives you time. AI gives you time to think. AI gives you time to better communicate with your patients, and it reduces your unwanted load. Data entry is a part of a data operator, not of a pharmacist. And that's how we can reduce our burden and improve the time and the more the purpose of a pharmacist in an organization, that is improving medication literacy, health awareness, everything that can be done with the help of AI. So I am always into reflections. So I want you to reflect your thoughts that what's really stopping you. Ask yourself, is it a fear of a judgment? Is it fear of mistakes? Or is it your comfort zone? Or are you waiting for permission? So anything around it, you need to discuss it with your peers and raise it to the organizational level where ethical use of AI is permitted, and that too using the SOP based AI workflows. So that's how you will integrate AI in your personal as well as organizational level, so that it would improve the efficiency, the efficacy of the person and as well as the organization. And what makes you different in the AI era? Obviously, not the tools, but the depth of questions you ask, the clinical reasoning you seek, the human empathy you have, and the responsibility you deliver to your patients. So that's what makes you different. And that is that you should not be, hesitant towards AI. And just to end, I would like to say AI gives you speed, and the pharmacists give the human soul. And future belong to the pharmacists who are, assisted by AI and human centered. And that's how you can leverage on the base of AI and remove those AI hesitancy. And that's it. Thank you. And you can connect me on LinkedIn as well as I have a YouTube channel where you can connect to me. And that's it. Thank you. Thank you, Adnan.
Thank you. What a wonderful
Yeah.
presentation. So I
Yeah.
really
Actually, you
enjoyed
need
it. Yeah,
Yeah, you need
I
to
really.
integrate AI. AI is a part, and then you can have a feedback through the proof part, through your own knowledge part, and that's how you get a more good information that can be communicated to the patient as well, and that is helpful for you as well.
Yes, yes, exactly. And nowadays it is, very much easy to make patient information leaflets as well by using AI. And it's a good thing, if we are using it for the, good purpose, unless and until we make completely, ask some personal questions like to AI. So this could be dangerous, I could say. So thank you so much for
Yeah,
coming to our channel, and we are definitely going to make a video series of it. And if you really enjoying our video, then you can subscribe to my channel and subscribe to Dr. Pradyuman Rajput channel. Don't forget to check out his channel. He is also making some more amazing videos, and which could be very helpful for the all healthcare professionals as well as for the students. So do check out his videos as well. Thank you.
thank you, Adnan, for having me. Thank you.